Hello, we are going to discuss preventive cardiology. It's a topic which is close to the heart of many doctors actually, but when it comes to following that, probably they are not very good at it. We are more tuned to treating the heart disease itself by angioplasty or a bypass surgery, but prevention is of paramount importance, and hopefully at the end of 30 minutes from now, you would be convinced about it. We are dealing with the science which is the evidence of 2B. You can see that mathematics is 1A, that means the highest evidence, 2 plus 2 is still 4. And philosophy, that is whether God exists or not, is 2D. Medicine is 2B because that's why the evidence keeps changing. And that's why the same lecture done about 2 years from now could sound different. But that's what it is, and we have to live with it, and we have to go by the evidence that we have right now. On the x-axis of this slide, you see education, urbanization, affluence, which is increasing. And on the y-axis, not very surprisingly, it's the diabetes, hypertension, and cardiovascular diseases. India urban is on the upswing, and the next 15 to 20 years, we are going to reach the summit. The developed countries like the North America, Australia, New Zealand, in fact, they are on the downward trend. And this is probably related to such activities of preventive cardiology spread across their society. The cholesterol awareness, the exercise awareness, the smoking awareness, all of them have led to a disease which is going down in their countries. And the onus is on us, the community of the medical doctors, to prevent cardiac diseases in the country, and also we should start on the downward journey from now. We don't have to reach the summit. We can start the downward journey personally for ourselves from today, for the family and for the society, for the families that we are treating, and in turn for the nation. We have to do this service by reducing the health cost burden of the nation. Over a period of decades, if you see in United States, the burden of cardiovascular disease, strokes, coronary artery disease, everything is going down, and that is related to the relentless effort of social activists and of course doctors who talk to the society, make the society aware, and overall the incidence is remarkably better. Why not start the journey of this type from today? We have three patterns: the risk, the disease, and the event. Say hypertension is a risk. At that level, we can prevent. Suppose I am a high-risk patient whose both parents are hypertensive, and if I marry someone who is as high risk as I am, then we are producing a progeny which is high risk. Little thought process like this can lead to primordial prevention. That means the risk prevention itself, whether it is for diabetes, for hypertension, or for coronary artery disease. The next step comes the disease. From hypertension and diabetes becomes atherosclerosis. That is where the primary prevention comes into play. And atherosclerosis leads to strokes, myocardial infarctions, and other vascular episodes. And this is where the secondary prevention comes. From one infarct to the second infarct is the secondary prevention. The best preventive efforts, in fact, come from the secondary prevention, but we all should concentrate on the primordial prevention as well as the primary prevention. The risk factors of coronary artery disease or atherosclerosis are very well known. The age, the sex, the culture or the stress in the society, and of course the heredity. And the modifiable ones are diabetes, hypertension, smoking, or nicotine abuse in any form, sedentary lifestyle, cholesterol which is high, a type A personality, and of course mental or social stress. We are very well know that these modifiable risk factors, if they are modified, the risk of an individual goes remarkably low. All these risk factors are exponentially increasing. That means if somebody is diabetic, is a hypertensive and smokes and has high cholesterol level, the risk becomes 64 times, because every time there is an added risk factor, the risk goes up by the raised to the power of 2. And similarly, it comes down that way if we manage the risk factors very well. And that's why every effort, every endeavor should be there to reduce the risk factor burden of the individual and of the society. The newer risk factors that are known, of course, will be discussed, but a doctor who smokes is not a very good sight. I think it's an ugly sight in itself. But the newer risk factors that we know are actually very well spread in the society. Before that, we'll take one social point about the doctors, about the smoking. In the age group of 13 to 18 is that we find that the smoking starts. So if we concentrate in our homes for the boys and for girls in our neighborhoods, in the societies about the tobacco consumption, and if we curtail the tobacco consumption at that age, then probably we are making justice to the society itself. Here we see arcus juvenalis, a white ring inside the cornea, which is hyperlipidemia, and usually younger people getting this means it is a familial hyperlipidemia. It can be prevented, it can be diagnosed, and it can be treated very effectively, and that's why it should be done that way. First detection of hyperlipidemia could come at the age of 30 itself. This is arcus senilis, which comes after 55 years of age. It probably doesn't have so much relevance to coronary artery disease, but it indicates degeneration. And you have seen this eye very often on television. Looking from a distance, actually this eye is of this gentleman, indicating that at advancing age you can get arcus, but it doesn't mean real atherosclerosis. Vitamin D is implemented as a new risk factor. Pollution is now increasingly recognized as a risk factor for coronary artery disease. B12 deficiency, as seen in the slide as pigmented knuckles, is a sure sign of hyperthrombotic state, and we see high homocysteines in them and leading to thrombotic events. A young man coming with an infarct before the age of 40 invariably will have B12 deficiency, and this it can be tackled very easily by treating the B12 in the very beginning. Periodontitis is a gum disease which leads to coronary artery disease, and in especially rural part of India you see them very often, and it should be treated or at least diagnosed well and treated to prevent coronary artery disease. Women have increasing incidence of coronary artery disease of late. And what is a risk factor in a woman? A sister having coronary artery disease is a real risk factor. Diabetes, short stature, a woman who smokes is at a higher risk of coronary artery disease as compared to man who smokes. In rural India, you see so many women chewing tobacco. So that tobacco abuse also leads to coronary artery disease. Whether it is unusual diseases like aortoarteritis or consumption of oral contraceptive pills for too long, these are also risk factors among women. There is a great awareness amongst women about the breast cancer. But if you look at this slide, the white dotted bar below is all that the incidence of breast cancer is. Maybe 1 in 22 is what the breast cancer could be in women. But in coronary artery disease is remarkably high. It is almost 20 times high as compared to breast cancer. So awareness of coronary artery disease in fact should be higher in women as compared to the awareness of the breast cancer. You can see the woman in the middle is holding tobacco in her left palm, and this is a habit which is absolutely routine in rural India. One more risk factor which is identified is non-adherence to medication. If somebody is hypertensive, diabetic or something and doesn't take medication, then the risk is definitely there. You can see if somebody is adherent about 80% of the times, then the risk of cardiovascular disease goes down by 50%, a phenomenal benefit for being compliant with the treatment which is offered to this individual. So it's a new risk factor, non-compliance. A typical Nigerian or Ethiopian marathon runner looks like this, lean and thin, very small waistline. He eats more proteins in his diet, very little carb or fats. And the Indian counterpart, in fact, looks like this. He is happy to be in his Ganga. He has a huge waistline, the central obesity. In fact, it is paradoxical that a poor country like India is suffering from the health hazard of central obesity. I don't call it metabolic syndrome. I call it a metabolic sin, because this kind of a phenotype can be prevented, and if you develop one, can be changed to become very normal. The central obesity is not just bad looking. Fat gets on to the pancreas, and that leads to the triad of diabetes, hypertension, hypertriglyceridemia, and you know the after effects of all this. Metabolic syndrome is typically short stature, central obesity, diabetes, hypertension, atherosclerosis, and of course hypertriglyceridemia. Look at the person sitting on your left. In 1980, the computer size was very huge and the man was not very obese. In 2013, the computer has shrunken in size and the man has almost tripled in his size. Obviously, the disease related to sedentary lifestyle and obesity are going to creep in the society. Here's also an interesting side of a person. Gentleman on your left side is typically maybe a modern day IT expert, age of 38, smokes, doesn't exercise, eats vada pav at 2 a.m. in the night, works 20 hours a day, doesn't take holidays, no exercise. And on your right is the late BKS Iyengar at the age of his 88, led a very sattvic way of life, a spiritual way of life. And we did their carotid Dopplers. And the carotid Doppler gives the CIMT ratios. Based on the CIMT ratios, which gives the vascular age of the person, and look at what happens to their age. Actually, the biological age was 38 and vascular age is 88. All of us cannot become BKS Iyengar maybe, but whatever is our age, lead a good lifestyle and be your vascular age, same as your biological age. And that's why we must know dietary principles. They are universal. They are for everybody. They are for children. They are for elderly people. They are for diabetics. They do not differ from an individual to individual. They are like driving on the road. Whether you have a car which has had an accident or not, the driving safety rules remain the same. So in diet, we can say that it should be predominantly vegetarian. Non-veg diet could be in the form of more of white meat, that is egg whites, chicken and fish. It should be predominantly high protein diet, low in fats and low in carbohydrates. Food for the body is what we should have, not food for the tongue. In fact, animals understand this, and as intelligent animals and as doctors, probably we should understand it much more. A concept of bad meal, good meal, or eat food for the body, food for the tongue should be introduced in the families. On the dining table, that should be discussed. A ratio of 90 to 10 is what? We eat 3 times a day, that is 100 times in a month. So out of 100 times, if you eat 90 times correct food, food for the body and good meals, then you are fantastic about your dieting. 10 times, that is at least 2 to 3 times a week, you are allowed a bad meal or you are allowed food for your tongue. If you follow this, probably your diet will be phenomenally good. Oil consumption should be 1 liter per person per month. Whatever the oil is, probably doesn't make so much difference, but the quantity does make a difference. Invert the pyramid of your eating pattern. Look at what happens when you invert the pyramid of eating. A person who has a big breakfast and a very small dinner has a V-shaped body. And a person who has a small breakfast and a big dinner goes off to sleep while watching television, obviously going to retain all these calories inside his body. And an Indian man or a woman retains all those calories in the central part. And that's why we have these central obesities going around in the society. About exercise, we should have a warm-up for about 15 to 20 minutes. Flexibility in the form of yoga and other postures would be about 20 minutes. Strength exercises for the muscles and the bones could be 3 times a week. Endurance exercise could be 3 times a week. And cool down period every day for about 10 minutes. So if you could spend about 1 hour every day for exercise, that is the most scientific way of exercising. If you could do everything every day, including a Sunday, it's a bonus for you. But minimum of 150 minutes of aerobic activity and remaining flexibilities and weight training, if it is added, then it is a complete form of exercise. The newer gadgets which have come into the market, like the Fitbits and the watches and the Apple watches, help you do very good exercise. It motivates you. Today you have walked 10,000 steps. Tomorrow you would feel like walking 12,000 or something of that kind. That, in fact, gadget helps you perform better, and you are more aware of how much you are exercising in the week, in the month, in the year, and it can motivate you to do better and better. At the same time, for doctors, I think it is extremely important to have adequate rest. How to do that and how to get to that adequate rest is something which we'll discuss when we come to time management. But it is of paramount importance that the body and mind rest adequately. The biggest problem with stress today is rumination. Rumination is dwelling in the past and blaming oneself for all those that happened in the past. And the other problem in India is thinking of the future. We are very curious about what's going to happen in the future. You dwell in the past, you think of the future, and you lose the best part, that is the present. That is the only thing that you can have control on. So training your mind to be in the present tense is extreme form of stress management. And the attitude of life. The left-sided glass says, the pessimist feels that the glass is half empty. The optimist feels that the glass is half full. These two everybody knows. Look at the third one. The spiritualist feels that this is not beer at all. It is Maya hai Maya. And the last one, the realist, finishes the glass, whether it is full, empty, Maya, doesn't matter. That is what nectar of life is all about. That is what reality or being a realist is all about. And as a doctor, it gives you the best position in the society to be the realists of the society. Sex should be viewed in a different mold altogether. It is one of the best health tonics for the body and the mind. A 20 minutes treadmill activity is equivalent to almost one sexual activity. It burns 150 kilocalories. In fact, there is no other exercise which does that much kilocalories in that short a time. And of course, it is very natural. It is very good for emotions. It is very good for the relationship. And that's why a good sex life, till whatever age you can manage it, is very good for health. Look at this ant carrying so many biscuits on top of her. Have you ever heard the ant complaining? Same is true about our time. We say there's no time for a doctor to do this and to do that. This is my way of looking at things. 10 hours of professional work. As a doctor, you work for 10 hours. It is more than enough actually. As a homemaker in the family, maybe she can work 10 hours. A child in the house who is a student, main activity, going to school, maybe a class, 10 hours a day is good enough. 2 hours, let's wait for commuting, getting ready, talking on the phone, time for social media, good time. 7 hours of rest at night, 1 hour of break in the afternoon makes it about 20 hours. So then you have 1 hour for exercise, 1 hour for family and friends, 1 hour for a personal time for a hobby, and 1 hour for maybe an intellectual should think of who am I, what am I here for. So in 24 hours, you have phenomenal amount of time. You make a capsule of 2 weeks of this. You don't work 10 hours on Sundays, so you suddenly have 20 hours free in 2 weeks. You don't go to the family and friend every day 1 hour, so you get about 5 to 6 hours free in 2 weeks time. So in a 2 weeks capsule, you can still do all these activities and yet have enough time to meet old friends, watch a good movie that is released, or do whatever you like, and that's enough time for quality time in fact. If you do all these things very well, the correct diet, correct exercise, the stress management, then these are the health parameters you could achieve. For a healthy person in the middle rank, it is BMI which is less than 24, blood pressure which is below 140/90 or better would be 130/85. Then all the parameters of sugar, the total cholesterol, and look at one on the right side column. For vascular diseases, for secondary prevention, you have stricter parameters and they could be achieved by diet, exercise, a correct lifestyle, and of course by drugs like aspirin and statins. In 1998, American Journal of Medicine published an article called Non-Invasive Management, a Paradigm Shift in Coronary Artery Disease. It was written by D. Nornish. And you can see a branch which is 95% critically stenosed. At the end of 15 months, in fact, it gets revascularized or regression of atherosclerosis, you can see. Coronary artery disease drawn in hand drawn on the top is in fact unstable plaque, denuded plaque, thin blue cap of the intima, red blood cells and platelets hovering around it. It can go into spasm. The yellow fat globules are in fact fat globules. The plaque is very soft. It can burst and it can form a myocardial infarction. This person is in the ICU. And the same plaque, after maybe few weeks of good treatment, the blue cap is thicker. It is complete. It's not denuded. No cells there. Fat globules are less. It is firmer and it cannot have myocardial infarction. The same person with a similar percentage narrowing can now walk 5 kilometers. So much is the difference between plaque stabilization, which can be achieved by all the methods that we said, including aspirin and statin also. One more example of regression of atherosclerosis. A very critical lesion in the LAD. In fact, I was offering angioplasty to this patient, but he just flatly refused for whatever reasons known to him. After 15 months, you can see just by lifestyle modification, he has regression of atherosclerosis and a plumb normal thallium stress test. So many examples can be quoted. Unfortunately, it cannot be published because it is so very difficult to prove a regression of atheroma. You need complicated 3D reconstructed MRIs to show that there is a regression of atherosclerosis. Or you need an IVAS, that is intravascular ultrasound, to show that there is regression of atherosclerosis. The degree of difficulty of proving regression is so high that not many papers come out, but we should believe that it is possible. And in a mini reversal of 5 to 10% is good enough for the patient to have lot of flow, no angina, stabilization of plaque, avoiding of interventions. My own friend, in 1997, I performed the angiography after a myocardial infarction. Had so many blocks. This is a hand-drawn diagram drawn by myself. I advised him bypass surgery. Today, after 14 years on lifestyle modification, correct treatment, aspirin, statin, and controlled risk factor, good parameters, he has an angiogram which is in fact better than what it was 14 years ago. What would have happened to him after a bypass surgery 14 years later? We don't know. But here is a person who is a living example. I know that anecdotes don't make science, but the anecdote should spur you to do something like this and achieve this kind of result for our patients. Once again, a revision of what parameters should be for secondary prevention, which we should be achieving in ourselves and in our patients. Aspirin and statin are the cornerstones. Traditional wisdom of good lifestyle should be implemented. Maybe we should have our own methods. I mean, we have a lot of Ayurveda and other things going on. There would be something which clicks, something which should be researched, and we should prove to the world that this is the method or this is the drug which can regress atherosclerosis. We have studied Loki juice, we have studied lasers, we have studied chelation. These are not the methods of regression. Something is round the corner and a Nobel Prize awaits such a discovery. And I hope it comes from India only. What should be the vision of a preventive cardiologist or a doctor who thinks about prevention? Use state machinery, bombard onto people. Every hour there should be an advertisement related to health, whether it is diet, exercise, smoking, overweight. This should be promoted. Awareness through TV, awareness to the people, reaching through children and their teachers. I belong to Pune, and Pune is extremely noisy on the first day of Diwali. This time it was remarkably quiet because all children forced their parents not to burst crackers. This can happen only through children because they are the ones who can motivate everybody around them. So attending to them, educating them, and drilling into their minds that health is a top priority is the way to bring about a social change into us. Of course, you should involve youth to spread through social media. In education, we are trying to train a lot of basic doctors with BAMS, BHMS, MBBS, giving them a 1-year course. At the end of it, they can manage the risk factors, they can talk about prevention, they can do this activity, and they could be a bridge between the super consultant cardiologists, cardiac surgeons, and the patients at large. This kind of a pyramid will work very well for prevention. And again, there should be something in our own methods which will bring about this change, and we keep researching for that method. Children should be involved not because they are diseased or obese, but they are the motivating force. Even for smoking abstinence, they say that if a child tells the parent to give up smoking, that is the most motivating talk that we can think of. The world is moving fast. We are going to soon wear this kind of a vest, all of us, which will have all kinds of sensors. It will detect sugars, it will detect blood pressure, it will let us know whether sodium is going up and down. So all this will be monitored somewhere else, satellite, through the satellite, and warnings will come. This is where the world is moving, and we should move towards maybe Ayurveda, try to develop some methods. Traditional wisdom has its own, it has lasted for 2000 years, mind you. So do something in that, find out what really it is, and prove to the world that this method can work somewhere else. Like the old Devdas was a grand movie, but the modern version of Devdas was watchable. We can watch it more affectionately because it is put into a modern way. Similar things should happen to Ayurveda, and similar things happen to Indian traditional ways of looking at it. We are intelligent lot. When it comes to locking our chappals while going to the temples, we can do it because the situation demands it. Similar things should happen. Something can click somewhere, and we can prove to the world what's happening. So if Barack Obama was looking that way, in the future, he could look this way if we prove to the world that we have a method which reverses atherosclerosis, or at least prevention the progression of disease. And about lifestyle, whatever needs to be done has to be done. A cat never complains. It has to run after the rat, it will. It has to sit in place, it will. So we have to do these lifestyle changes as if we take a bath every day. Nobody tells us how to take a bath, but for years we take it very well. Similarly, diet, exercise, cessation of smoking, enjoying life, being camarader to others, building good relationship, building our risk factors, trying to do repeated checks. I think all that should be done so very easily. It should be part of our life. The phenomenal amount of executive checkups are something which should be discouraged. I feel at the age of 30, you should have the first ECG, sugars, cholesterol, hemoglobin, vitamin B12, vitamin D3 is all that you need to do. If you are normal, repeat it after 5 years. At the age of 40, maybe you can add a routine treadmill to it, but otherwise nothing more than this. And such a pattern can continue every 5 years if everything is normal. If something comes abnormal, a doctor can intervene and take it from there. Prevention has a paradox. Look at the huge boat. If somebody has to do that and a person alone cannot do it, or you need to have a big motor to run this boat. But all of them pitch in small little pit, and the boat can go very fast in these races if you have observed the videos and the films. Prevention has a similar paradox. A small change introduced in a large community has phenomenal value as compared to a major change introduced in a small community. For example, if you reduce the smoking percentage of all the doctors, then the prevention of so many bypass surgeries, so many angioplasties will take place. And doing 100 angioplasties in a year is a major change in a small community. It has its own value, no doubt. But introducing this risk of smoking, introducing diet, lifestyle change is what it is order of the day. And that is what we should move on. Starting from birth on your left hand top and natural death on your right hand corner below, draw a straight line. If somebody gets triple vessel coronary disease, he is rapidly moving towards his premature death. But a good CABG bypass surgery puts him back on the track. If somebody gets double vessel disease, he is also moving towards his premature death. But a good angioplasty will put him back on track. But the yellow square in between is actually what prevention is. The preventive lifestyle, the awareness of the society, how we do our checks, how we spread in the society, how we introduce this small change in a large society, all that will see to it us that without having to undergo the bypass surgeries or angioplasty, we can still go to our natural death very peacefully. And that's what Hindu philosophy is all about. So if we look at all these things, we need to inculcate these habits ourselves. As doctors, we are the health preachers of the society. We should start with ourselves, our families, our friends, our social circles. Then comes the families that we treat probably, and then it will percolate into the entire society. If we do that, then we are looking at a very low incidence of cardiovascular diseases in the society. And that is the way to go for India. We need money to go to the Mars, or we need money to feed the poor who don't have 2 meals of the day, rather than spending on the heart attacks and angioplasties and bypass surgery. Thank you.